Hello, everyone. My name is Baylee Gray, and today I'll be presenting on workplace violence and emergency departments and how it contributes to healthcare waste. This issue affects hospitals across the country and has significant financial, operational, and workforce implications. In this presentation, I'll walk through the major drivers of ED violence, how these incidents create preventable waste, and the fiscal impact at the national, state, and regional levels. I'll also highlight the need for stronger policy standards and outline recommendations healthcare systems can adopt to reduce both violence and waste. Healthcare waste refers to any spending or resource use that does not improve patient outcomes or system efficiency. When workplace violence occurs in the emergency department, it immediately generates waste through workers' compensation costs, lost productivity, property damage, and operational disruption. But the deeper drivers of waste are rooted in systemic inefficiencies, such as inconsistent prevention practices, staffing shortages, and reactive rather than proactive safety strategies. When prevention programs are weak, violent events repeat, and with each incident, the financial burden grows. This makes workplace violence a clear and preventable contributor to healthcare waste. Emergency departments are among the most high-risk environments in healthcare for violent incidents. EDs manage high acuity patients, unpredictable medical and behavioral conditions, and a constant flow of individuals experiencing crises. Structural factors like crowding, long wait times, and limited secure spaces intensify tensions and reduce staff visibility. In addition, behavioral health boarding, where psychiatric patients wait extended periods for placement, significantly increases agitation and risk for aggression. Combined with staffing shortages, these factors create a setting where violence is more likely to occur, placing staff at risk and increasing operational and financial strain on hospitals. Workplace violence is not an unavoidable cost, it is preventable, and the consequences of failing to prevent it are expensive. Direct costs include medical treatment for injured staff, workers' compensation, legal fees, and property repair. But indirect costs are even greater: turnover, burnout, reduced productivity, and slower ED throughput. Unfortunately, the absence of enforceable federal guidelines means prevention strategies vary widely between hospitals. Without consistent reporting, clear accountability, and evidence-based policies, organizations remain reactive rather than proactive. This reactive approach leads to a continuous cycle of waste that strains healthcare systems financially and operationally. At the national level, workplace violence costs the healthcare system billions each year. Workers' compensation claims, staff injuries, litigation, and lost workdays represent substantial direct expenses. However, the broader national impact comes from turnover, reduced productivity, and lower patient throughput. EDs have some of the highest turnover rates in healthcare, often driven by violent encounters. Replacing a single ED nurse can cost tens of thousands of dollars when considering recruitment, onboarding, and lost productivity. As these expenses accumulate across hospitals nationally, workplace violence becomes a major contributor to nationwide healthcare waste and system inefficiency. In Texas, emergency departments experience unique pressures that magnify the financial impact of workplace violence. High patient volumes and significant psychiatric boarding increase the likelihood of violent incidents. Each event results in both direct and indirect costs, ranging from medical evaluation for injured staff to overtime expenses incurred when hospitals must cover staffing shortages. Texas facilities also spend substantial resources on retention efforts and agency staffing due to violence-driven turnover. These staffing disruptions slow patient flow, lead to temporary bed closures, and reduce operational efficiency, ultimately increasing statewide healthcare waste. In the North Texas region, the financial strain from ED violence is even more visible. Violent incidents cause staff injuries and emotional trauma, leading to absenteeism, turnover, and increased counseling or recovery needs. ED diversions, when hospitals temporarily stop accepting ambulances, result in thousands of dollars in lost revenue per hour and weaken community trust. Operational disruptions, such as closing care areas for investigation or cleanup, further reduce treatment capacity. Regional staffing shortages compound these challenges, making recruitment and retention costly. As incidents accumulate, the financial waste becomes substantial and directly impacts local healthcare system stability. Workplace violence produces both direct and indirect costs that weigh heavily on healthcare systems. Direct costs include medical care for injured staff, workers' compensation claims, legal expenses, and damage to equipment or facility infrastructure. These costs are immediate and measurable. Indirect costs, however, are more long-term and often greater. They include staff turnover, reduced morale, burnout, decreased productivity, and slower throughput. Indirect costs also impact patient care by increasing wait times, prolonging length of stay, and contributing to overcapacity. Over time, these factors significantly diminish both financial performance and care quality. Currently, the United States does not have a mandated federal standard requiring healthcare facilities to implement workplace violence prevention programs. OSHA provides guidance, but it is voluntary, leading to inconsistent implementation. Federal standards would ensure baseline requirements across all healthcare settings, such as risk assessments, staff training, environmental modifications, and mandatory incident reporting. This level of consistency would reduce violent incidents, improve staff retention, and significantly cut back on turnover-related expenses. Establishing national standards could save billions in preventable waste while greatly improving staff safety and organizational stability. To effectively reduce workplace violence and associated waste, healthcare systems must adopt a comprehensive set of strategies. Evidence-based prevention programs, strong reporting systems, and consistent staff training are essential. Environmental upgrades such as improved lighting, secure staff areas, and reliable alarm systems enhance safety and reduce opportunities for aggression. Workforce support programs such as trauma-informed counseling and resilience training can also improve retention and reduce burnout. Together, these interventions create safer ED environments, reduce violent incidents, and decrease the financial waste tied to turnover, absenteeism, and operational disruption.